Wanda Theron fills her husband's prescription for the generic antibiotic doxycycline at a Target in Simi Valley. For years, the medication has cost her $6 a month. In February, however, the price tripled to $18 for 30 pills. And this month, it's skyrocketed to $133. This is noteworthy enough. But what happened next makes the entire business of drug pricing a study in lunacy. A pharmacy clerk at Target suggested running the prescription through the company's discount program, Theron, 61, recalled. After a minute at the computer, the clerk I'd been dealing with came back and said my price was now $8. That's right, a $6 drug turns into an $18 drug and then a $133 drug. But with a little retail hocus pocus, it can be changed to an $8 drug. Talk about a trip through the looking glass. I heard a number of stories similar to Theron's after writing recently about a CVS customer who saw her bill for generic doxycycline jump from $4.30 to $165. One reader told me about a doubling of the price of the generic gout medicine colchicine. Another cited prices for the generic version of the blood clot blocker Plavix that ran from $21 to $400. Question: how does this happen? Answer: it's complicated. The ingredients of prescription drugs come from all over the world these days. Sometimes there are shortages, sometimes not. Sometimes numerous manufacturers will produce a generic drug, pushing prices down. Sometimes only a handful of makers will be in the game. There are industry lists of so-called average wholesale prices for generic drugs, but pharmacists say these are meaningless because they're not the prices wholesalers or pharmacy chains pay. The average wholesale price is a made-up number, said Esther Leitner, a pharmacist at an independent drugstore in Beverly Hills. Nobody goes by the average wholesale price. So how are generic drug prices set? Apparently, it's anything goes. Leitner described her own process for buying drugs. She and other independent pharmacists in the region have formed a buying group, and together they negotiate the best possible price with a wholesaler. The wholesaler, for its part, haggles prices with drug manufacturers. The manufacturers set prices at whatever level they think the market will bear. But manufacturers aren't solely to blame. A pharmaceutical economist told me that drug stores often jack up prices for generics as an easy way to boost revenue. Wholesalers might also cut themselves in for extra profits by boosting prices to drug stores. Meanwhile, Leitner said, insurers have caught on to the pricing shenanigans and often reimburse drug stores for patients' claims at levels they believe are closer to a drug's actual cost. In other words, below what a manufacturer, wholesaler or drugstore may have charged. Insurers also keep patients in the dark by failing to inform them of what's actually happening in the market. All the patient typically is aware of is his or her copay or coinsurance cost. I asked Target to explain the pricing roller coaster that Theron described. Jessica Deed, a company spokeswoman, said she couldn't discuss an individual customer's experience. But she said that many factors can impact pharmacy charges, including a guest's insurance plan, price changes from manufacturers, if a provider has named the pharmacy a preferred location, and the guest's deductible.